You know, if you ever deal with headaches, migraines, things like that, and it doesn't matter, you know, you take medication and it goes away for a little while, then it comes back, may have some underlying issues you have to deal with. That's why we talked to Dr. Sonia Spencer here at Spencer Chiropractic, Pass Road in Gulfport, across from Pass Road Elementary. Always a pleasure to see you, Doc.
You too, Jim.
Well,
welcome.
Thank you very much. And we've been here, we've been doing the show together for like 17 years now.
It's been a long time.
Getting really, really educated. I mean, and you have helped me. I mean, when I was in a bad car accident, you helped get me all straightened out. But people sometimes deal with different things, and one of them is headaches.
It's headaches, yes, correct. And you know, so many people deal with headaches every day and they feel like, I have normal headaches. That's what they say when they come in. I have normal headaches that happen every day, and then I have bad headaches that I get once or twice a week. But one thing I want people to know is that living with a headache every single day or even once or twice a week is not normal. Mm-hmm. And sometimes, you know, people are getting on medications or multiple medications for these headaches, and chiropractic care can help them. So headaches are not always an easy thing to treat. Mm-hmm. They can be difficult to diagnose where they're coming from. But one thing about chiropractic care is it's non-invasive, it's safe, it's one of the safest forms of treatment that you can have. It has less side effects than medications, and it's really effective for treating headaches. So one of the things that we look at when we talk to a person who has headaches is how often, how frequent, how severe are you having headaches? And many times what happens with headache patients is even if we can't get them to go away all the way, their frequency, how often they're getting them, will
diminish
greatly, 75 to 100%.
Wow.
Yeah. The intensity, you know, they might be having 10 headaches that send them to the emergency room, and, you know, they're not having to go anymore, or, you know, that part of their life is over.
Well, I've known people that have migraines so often that sometimes they can't even function. They can't go to work,
Yes.
have to stay in a dark room with all the lights out and everything because it's just so painful to them.
Right, and you know, in today's world, people are looking for treatment that's non-invasive, right? Without shots, without drugs, without surgery. And chiropractic offers that. You know, we just look at some of the things that could be causing headaches in a person, mm-hmm. and help them eliminate some of those pressure off those nerves that could be causing headaches. So let's talk about some of those. You want to?
Please.
All right. So you have a little group of nerves that come out between your first and second bone in your neck. And when these when these nerves get irritated or aggravated, it can cause pressure and cause you to have a headache. Also, you see this little nerve here, mm-hmm. out to the shoulder.
Right.
So who doesn't mouse and use devices or talk on a cell phone or do something like that? So today, we're in an environment where people are just chronically using their shoulders, you know, for different things. The mommies that come in, that, you know, they put their put their purse on there, they put their diaper bag on there, and then they have their baby on the other hip, and then all of a sudden they're getting these tension headaches from carrying too much stuff on their shoulders, and that the muscles over tighten and it grabs the nerves, and those nerves irritate, and that's what's causing their
And I would
headaches.
imagine you see more women with these issues all the time, you know, with the neck and everything, than you do men, because of all the things that you said that they do.
Exactly, we do. But sometimes men too, especially men who've played football and sports. Mm-hmm. You know, years ago we weren't really talking a lot about concussion, but you see it now very frequently talked about, and especially with sports, a lot of head butting and things like that. And a lot of men pay for that, you know, in their 30s and 40s by getting headaches, mm-hmm. you know, repetitive headaches. And so it jams these joints in their neck. Mm-hmm. That causes pressure on the nerves, and those nerves just stay irritated, and it doesn't take much to set them off to where they're just pretty much living with a chronic, constant headache. And, you know, sometimes medication will help for a few hours, but as soon as it wears off, the headache's right back. And really the source of the problem is not being addressed when you take a pill. You're just alleviating
Covering
this,
it.
covering up
Like putting a
symptoms.
Band-Aid on it.
Yes. So in chiropractic care, the natural approach is to gently, get the joints moving better, get the pressures off the nerve so the body can relax and this can really be healed. Like I said, there's many different causes of headaches, but chiropractic is the least invasive thing you can do for your headaches, and that includes taking an aspirin. Chiropractic is safer than aspirin. It's safer than any over-the-counter or medication you can take. And it's certainly safer than getting shots or getting a surgical procedure.
I remember when I had my truck accident a few years ago, I was having, of course, neck pain and everything, and it led to headaches and all that. And you helped helped ease that off of me because of the adjustments that I came in and got done a few times a week.
I'm telling you, I can't even tell you the number of patients that have come in here with chronic debilitating headaches as a way of life, and they get adjustments and they just go away. They quit having those headaches and they get to move on with their life. And like you said, they've been canceling plans. It starts affecting their life and affecting their ability to work and do the things that they do on a regular basis. And that can cause depression. That can cause other symptoms. If you're having pain that starts affecting your social life, your family life, and the things you do and the things you love to do, you're a person who loves to go to work every day, and then all of a sudden, you're having problems get to your job because you wake up and you have pain, So, and I know we're taught as a society, just pop this pill and you'll feel better. Every other ad on TV is about a drug commercial, more or less, right?
But then they added all those side effects that come with it and everything. And again, as you said, with chiropractic care, you don't have all those side effects.
You don't have all those side effects, no. It's very safe care. And, that's what I'm here to tell you. There's natural things that a person can do. Because the last thing you want to do is, have side effects from medication. So if you're having headaches, even weekly headaches are not normal. If you're having headaches and they're affecting your life, give us a call. I love helping people with headaches. I love getting into the bottom of things, and I love success stories with headaches. And I love helping people change their life and get their life back to normal by reducing those headaches and helping people have a better quality of life with chiropractic care without drugs, without shots, without surgery, just helping people live better lives.
And that's the great thing about it. The chiropractic care that you can give them is to help them lead better lives. And there's so many different ways that it can. And of course, Dr. Spencer, always a pleasure to come talk to you. Again, if you're dealing with chronic headaches or just headaches more often than you should, what you need to do is come in and talk to Dr. Spencer, set you up an appointment, get some, maybe some x-rays if you need to, and find out if there's any underlying problems, and get yourself headache-free with Dr. Spencer, Spencer Chiropractic, Pass Road in Gulfport.